Welcome, everyone. Ritu, do you want to kick us off?
Absolutely. Thanks, everyone, for joining us. Good morning, good afternoon, good evening. We are really excited to welcome you to this panel on the occasion of the High Level Political Forum. We are incredibly delighted that at long last, the issue of care work is finding its way onto the global agenda. I've been doing this work on women's economic opportunity for 30 years, and care work has always been an issue. Care work has always been the biggest barrier to women's economic participation. So it's wonderful to see it coming on to the agenda, to be seeing it that we're having these discussions, that we are finally coming up with specific and actionable policy recommendations to address this. So again, want to welcome you here, have a little bit of housekeeping that we'd like to go over with you. So first, the webinar is being recorded and closed captioning is available. I believe you can click the button on your screen that says live transcript if you would like to see the closed captioning. We'd love for you to drop questions in the chat. Please add your name and email address. If we're not able to get to your questions during the event, we will be able to follow up with you via email. So, of course, social media engagement. We want to make sure we can amplify the conversation that we're having here. And you'll see our hashtags at the bottom of the screen here today. At WeProsper is our Twitter handle, and would love for you to be tweeting as we go along. So thank you so much for that. So we've got a really amazing, diverse panel today. And they are looking at this issue of the care economy from lots of different angles. What we're hoping we will do today is have a really practical dialogue on how to balance, how to support care as a right within our current extremely difficult economic context, which has really increased the load of care work on women around the world. We would like to recognize some progress on SDG 5 and the Generation Equality Forum goals, which did contain some fantastic commitments around care work that we would really like to highlight. So I want to just take a minute and share with you why does CARE as an organization work on care work? As you can imagine, it would be impossible not to, as our name suggests. In our work on women's economic access and rights, and as one of the co-chairs of the Economic Justice and Rights Action Coalition, has been part of the Generation Equality Forum and is an ongoing group. This barrier to women's economic participation could also be an incredible economic opportunity for women if countries invest in creating care infrastructure. Some of the things that we're involved in, many of you may have heard about CARE's village savings and loan associations, and many of them around the world are addressing this issue of care work by creating care cooperatives, essentially, so that members can share care work with one another and enable women to then pursue other economic opportunities. I think one of the biggest issues in care work is how to share the care with our male partners, our male relatives. And that's something that's really important to CARE International, is that we engage men and boys in this solution. I don't know how many of you have children, especially when your children are small. That negotiation of who does what care work in a relationship, in a household, is an extremely important one. And I can certainly attest to the dilemmas and stresses around balancing care work, childcare, elder care, disability care, sick care, with a desire to have a profession or a desire to work and earn an income. So with that, I would love to introduce and hand it over to Kelsey Harris, who is our fearless WeProsper leader. She's a senior global policy advocate at the International Center for Research on Women. She's our coalition coordinator. And if you don't know WeProsper, I'll just give you the one sentence. It's a global policy and advocacy coalition on women's economic empowerment. Kelsey has over 10 years of experience in policy advocacy coalition and project management. She's had a number of different roles in Washington, D.C. And just before WeProsper, she was leading advocacy around gender, water, sanitation, and hygiene at Interaction. So over to you, Kelsey. Thanks so much for pulling us together, and I'm really excited for our conversation today.
Thank you so much, Ritu, and thank you all for being here today. It is such an honor to be speaking with all of you today on the margins of the high-level political forum. So recently, care work, both formal and informal, has been the focus of this growing global discussion as the world works to recover from the gendered social and economic impacts of COVID-19. Governments and donors have been responding with new commitments and investments on care, such as Canada's commitment to invest $100 million in global care programming, Germany's focus on care throughout its G7 presidency, and the launch of the Global Alliance for Care as a collective commitment at the Generation Equality Forum. So as governments are evaluating how to invest in care and how to balance those investments with others, while there are competing priorities and fiscal constraints, thoroughly assessing existing evidence is very key for us to inform our policy recommendations. Thus, WeProsper has been performing a synthesis of evidence on care work and its connection with we. This extensive research has been led by my esteemed colleague, Dr. Mary Barman, who unfortunately could not join us here today to present this overview, but sends her best regards. WeProsper will soon be releasing a two-part research synthesis report series, the first installment of which will be released in the next couple of weeks and will be focused on care services, including childcare and long-term care, the latter of which has not been as central to the conversation as it should be. The second installment of this report series is going to be focused on care infrastructure, such as transportation and water, sanitation, and hygiene. And today, I am pleased to give you a sneak peek into the first report installment today before it is released. So globally, care work is largely informal, with poor working conditions and low wages. And most care workers are women, often migrant women, women of color, or women from historically marginalized groups. As such, the needs, quality of employment, and rights of care workers are critical components of ensuring that investments in care services support women's economic empowerment, justice, and rights. A holistic approach to addressing the spectrum of paid to unpaid care integrates the 5 R's of care: recognizing, redistributing, and reducing unpaid care work, and rewarding and representing paid care work. There's a clear economic case for investment. Our review of the evidence shows that investments in care serve as a form of social infrastructure and are strategic economic policy decisions. Critically, investments in care services impact the economy in different ways than traditional infrastructure, with greater employment benefits, particularly for women. If I could have the next slide, please. So first, we took a look at the evidence on childcare. Although data is limited on childcare in low-income countries, what is clear from the data available is that affordable and quality childcare is low and greatly needed. Even before 2020, the global childcare situation was in crisis. 40% of children under primary school age, or approximately 350 million children worldwide, lack access to needed childcare. 8 out of 10 of those are in low and middle income countries. COVID-19 just increased the need for childcare and placed further care burdens on women. And the result of that was that women left the workforce in all sectors in far greater numbers than men. Costs appear to be a significant constraint in low and middle income countries, and there's often not many affordable options. For example, in Kenya, childcare costs comprise 12% of household income on average. And in Mexico, the fees of a federal daycare program were 22% of the monthly minimum wage. A series of new studies by UN Women and the ILO has shown that while significant resource outlays of 1.1 to 14% of gross domestic product will be required to fill childcare provision gaps, filling these gaps brings numerous benefits, including creation of jobs and tax revenues, which would actually offset those expenditures by 10.5 to 51% of the cost of investment, plus bringing positive impacts on women's labor force participation, employment, and overall hours worked. One review of 13 studies in low and middle income countries found that women's employment increased 6 percentage points on average, with an average of 30% increase in daycare utilization. In reviewing the data available, it is clear that more data is needed on government childcare expenditures, particularly for low and middle income countries. However, what we do know is that though expenditures are increasing compared to other care services, they're still far below what is needed to fill childcare provision gaps in low and middle income countries. And current foreign aid for childcare appears to be quite low, despite the abundance of evidence on the role of childcare for supporting human capital, poverty reduction, and other development priorities. Despite recent multilateral investments like the collective commitment of $180 million for the World Bank's Child Care Incentive Fund, significantly more resources by international financial institutions, donor governments, and others will be necessary to fill the childcare financing gap. We also reviewed the evidence on childcare policies supportive of including childcare subsidies, cash transfer programs, and free public early childhood education, daycare, and after-school programs to get a better idea of what works to support Though universal free public provision is the ideal, we also found positive impacts across all types of interventions and in different contexts, the extent of which depends on how each of those programs are designed. All of that will be very informative for policymakers that are considering different approaches. If I could have the next slide, please. When it comes to long-term care services, including care for older people and for those with disabilities, we found that government policies have been less responsive and research and evaluation much more limited as compared to childcare, particularly as it relates to and impacts on unpaid care time. This is a huge issue, given that the global population of those 65 or older will be 1.5 billion by 2050, and already about 1 billion people experience some form of disability. Eastern and Southeastern Asia and Africa are experiencing rapid growth in the population of people 65 years and older. However, only about a quarter of older adults above retirement age in sub-Saharan Africa are covered by a pension. With the evidence available, we found that disability care in developing countries is more scarce than childcare, despite the majority of persons living with disabilities living in low and middle income countries. Effective coverage of persons with severe disabilities receiving benefits was only about 27.8% in 2015, and there's significant regional disparities. In some countries, such as Asian Development Bank countries, long-term care needs are not being met by governments. So the burden then gets shifted to care recipients and their families and must be met through out-of-pocket expenditures. Yet there has not been a systemic evaluation of what those costs are for care recipients and their families. Overall, the benefits of investing in long-term care are very clear. Investments are projected to generate significant employment in addition to tax revenue, which would partially finance those investments. In fact, an investment in long-term care of 2.45% of GDP could create 184 million jobs, with women benefiting from as much as 78% of that employment increase, reducing the gender employment gap by 7.4 percentage points. That is huge. When it comes to the models for financing long-term care, the OECD suggests that a dedicated stream of public investments financed by a reliable source works best. However, more data is needed on government expenditures, programs, and policies in low and middle income countries in particular, especially as it relates to effectively reducing and redistributing unpaid care. Where evidence is available, government policy responses like provision of long-term care insurance, pension systems, or disability services have been slow or lacking, and reliance on family care models are prominent, which is unsustainable with female labor force participation rising in many countries. However, long-term care is beginning to get more policy attention by some entities like the African Union, who recently developed a framework on long-term care for adaptation by African countries to address national and local needs for elder care. Analyses of donor funding on long-term care are also needed to assess what kinds of programs are being funded and what systems work best in different contexts. Currently, there's limited data available on donor financing, which to us is a sign that donors are not paying sufficient attention to elderly care and long-term care needs. In terms of policy approaches that support enabling environment for care services, and we found evidence of a number of policies that work in different contexts and ultimately support reductions in unpaid care time and WE goals. These included paid parental leave policies, paid family and medical leave, family-friendly and flexible workplace policies, labor protections, decent work for care workers, and the list goes on. For example, paid family and medical leave supports caregivers' mental health, labor force attachment, and well-being as they navigate family care needs. However, only 29% of 186 countries surveyed in 2014 provided workers leave to care for their elderly parents. Overall, our review of evidence has been enlightening and provides a strong case for further investment in care services. Given the extent of care gaps in low middle income country contexts, the negative impacts of not addressing these care needs, including on women's economic empowerment, justice, and rights, and the potential benefits of these investments for a broad range of economic and social outcomes. We feel that coordinated global action to support financing, care service provision, and low and middle income countries is necessary given the fiscal constraints that they are facing in order to meet SDG and generation equality forum goals, as well as to ensure that the negative impacts of COVID on women's economic empowerment, justice, and rights are not perpetuated, and instead, more inclusive and sustainable economies are built. This is all just a snippet of the analysis that we've done around care. So once the report comes out, I encourage all of you to take a closer look for additional details on our findings, and please help us to share the report widely. You can feel free to also reach out to WeProsper with questions, or if you have suggestions to leverage this analysis, we welcome them. We're going to be building off this synthesis to develop specific policy recommendations, and we'll be engaging with policymakers to better highlight this evidence and advocate for research-backed policy change around care work. So stay tuned. Thank you all so much, and back to you, Ritu.
Thanks so much, Kelsey. Really excited for the report to come out. Can't wait to see it, and it'll be wonderful to have this compilation of data all in one central location. So very much appreciate your work on that. So I'd love to introduce our panel, an amazing, amazing group of women. First, I want to introduce Mando Chiandaponde. She is the Economic Justice and Rights Officer of FemNet. She is self-described as an economic and social accountability activist, which I love that title. And she has a focus on research, economic justice, and natural resource governance policy, engagement, social accountability monitoring, and advocacy. Thanks so much for joining us, Mando. We're really delighted to have you. Also, Emmeline De Leon is an expert consultant for In Mujeres and supports the Global Alliance for Care and the building of that coalition and alliance. So very excited to have you, Emmeline. She is also a capital F feminist, which I love, and is the former director of Prospera, an international network of women's funds. She's been working on women's economic empowerment projects for 20 years and has experience in feminist philanthropy. Jessica Espinosa is the CEO of the 2X Collaborative, which is an organization that brings together industry for gender lens investing and bringing together capital providers, and they have raised more than 11 billion for gender lens investments since they were launched at the G7 summit in 2018. Megan O'Donnell is a policy fellow and assistant director of gender equality at the Center for Global Development. She works on issues related to women's economic empowerment and financial inclusion, gender data, measurement, and development effectiveness. She's written quite a bit on care work. Prior to CGD, Megan was at the One Campaign, the Inter-American Development Bank, ICRW, and Care USA. Great to learn that, Megan. Meredith Wise is a senior social development specialist in aging and care, sustainable development and climate change in the Sustainable Development and Climate Change Department at the Asian Development Bank. Meredith specializes in issues related to aging and care. So I want to welcome our panelists. Thank you so much for joining us. I hope everyone can see our panelists. Mando, if you don't mind, if you're able to turn on, wonderful. Thank you so much for turning on your screen. All right, so let's go into our first question. We'd love to hear a little bit more about your organization, what you're doing on care work, and just tell us a little bit about what you're seeing on care work, the knowledge, the funding, the gaps. Give us just a quick orientation. We'll have each speaker speak for about 4 minutes. Once you hear me starting to say, that's wonderful, thank you, that's your cue that your 4 minutes is coming to a close. So thanks, all of you. Let's start with Mando, please. Go ahead.
Well, thank you so much, Ritu. Could you just confirm if you could hear me clearly?
Yes, we can hear you loud and clear. Thanks.
Okay, great. As you mentioned, I'm from FEMNET. We're the Africa Women's Development and Communications Network. And as you would be able to tell from that name, we actually have women's rights work at the core or at the heart of what we do. We are a feminist Pan-African women's rights organization with over 800 individual and institutional members in 50 countries across Africa and in the diaspora as well. And our core mandate is to amplify women's voices and to advance women's rights in both policy and practice, which means a lot of movement building, thought leadership, enhancement of capacities and skills of women that we work with, as well as leading in driving initiatives around economic justice and advocacy. So one of the key things that we've been working on in the last decade, one of the key and important advocacy pieces for us has been care, or the economics of care. And this is particularly because we acknowledge that it's something that women and girls predominantly have to provide in the African setup because they've been socialized to do so. And often this is unpaid care work, resulting in an unimaginable burden and loss in the lives of women and girls. So the last couple of years have been a marker of, systemic disregard for the important role that care has. We've had the COVID-19 pandemic. I think it's really highlighted serious gaps in knowledge, funding, and provision of care within our context. And this is very real on the African continent, where there's too much to be done in terms of recognition of care work. So as FEMNET, we look to influence a lot of reform in both policy and practice. And this includes an advocacy which we've shaped with our member organizations within the realms of what we call the 5 Rs. So that's recognition, redistribution, reduction, representation, and response to care issues. And within that context, also investment in the care economy. So we've also gone a step further to publish and launch what we call the Africa Care Economy Index. I'll be speaking to later, of course. And this takes stock of Africa's care economy and the very real gaps to provision and financing, but also the impacts on women's quality of life and socioeconomic well-being. I think that overall would speak to what FEMNET does on care work.
Great, thank you so much, Mando. I'm really excited to hear more about your work. And Jessica, over to you.
Thank you, Rita. The 2X Collaborative, as you just mentioned in your introduction remarks, is a global industry body for gender lens investing That's convening the full spectrum of investors and capital providers globally who are investing in the private sector and adopting a gender lens investing approach. One of our flagship initiatives is the 2X Challenge, which has invested and mobilized more than $11 billion since we launched the initiative at the G7 Summit in 2018. And all of that has been focused on private sector investments with a gender lens. But since then, we've been going a lot deeper into seeing what are actually the investment gaps and funding gaps, specifically in the care economy, and how can we be more intentional in channeling capital in a way that promotes equal care and investments in the care economy. Now, the care economy is not among the sectors that private sector investors have traditionally focused on. And for many, it's still not entirely clear what we actually mean by this investment opportunity and opportunities for the private sector to engage. But COVID has really put a spotlight on gender gaps globally, as you all know, and especially on the topic of care. And so this greater visibility of the crucial role of care, coupled with the rise that we see in gender lens investing, has been a key driver and lever in bringing the whole topic of the care economy into the focus of private sector investors. And we are now seeing growing interest among these investors and capital providers. So when I say investors, I mean the traditional equity type of investors, but also local financial institutions and really the full spectrum of capital providers who are keen to explore concrete investment opportunities and the role that they could play in the care economy. There is a growing recognition in that the private sector and investments in the care economy play an important role. There are definitely huge funding gaps, as we've seen in the past, and so also an opportunity for the private sector to step up and play a more prominent role. But in addition to driving volume and greater investment, there's also great recognition that we have to make sure we focus on quality. So valuing care work is crucial especially if we're thinking about building back better and kind of a more just and inclusive and resilient recovery. And it's also central to the whole mega trend of the future of work. So we're trying to really connect the dots and not position the care economy as kind of a niche that nobody really knows how to deal with, but really make it front and center and embedded in these mega trends of build back better and the future of work. We're now focusing on a transformative approach to care. So I'm very pleased that Mando also just mentioned the 5R framework. This is also how we're looking at it. So recognize, reduce, and redistribute unpaid care work, and reward and represent care work. And we are part of a larger global care initiative, which is seed funded by IDRC and OSF. And that is bringing together investors, ecosystem players, and also care economy businesses and entrepreneurs in a broader initiative. And under this global initiative, the 2X Collaborative and Gender Smart are leading a care economy working group that's focusing specifically on spearheading more investments in the care economy and developing practical investment tools and approaches and showing that opportunity.
Wonderful. Thank you so much. And look forward to hearing more about how that work is going, what traction you're getting with private investors and others. Let me turn now to Emmeline. Would love to hear more about the Global Alliance for Care, what you've been doing with that, how can organizations and people get involved, and what you've been able to do so far.
Thank you so much, Ritu. First of all, are you listening to me? It's okay? Okay, good. So first of all, thank you very much to WeProsper, ICRW, and CARE for inviting the Global Alliance for Care to participate in this interesting panel. I'm just seeing connections immediately with all the panelists, and especially with Jessica. So let me explain very briefly. So the Global Alliance for Care is an initiative that has been launched at the Gender Equality Forum last year, first announcing in the Mexico Forum and then formally launched in the Paris Forum. It is from the Mexico government in Mujeres, the Instituto Nacional de las Mujeres, with UN Women jointly launched this Global Alliance for Care. And it is We are very glad because from that launching, we are now 70 members. It's a multi-sectorial space. It is under the Economic Justice Action Coalition of the Gender Equality Forum. And we have governments, we have civil society organizations, we have also care workers organizations, international organizations, we have private sector, philanthropists, academia, international institutions. So it's a multi-sectoral space. And what we are doing is a sharing and learning process, a platform where people can share, learn, and expand the care economy agenda. So we have been working, our principles mostly are, of course, we are under the 5 R's: recognition, reduction, redistribution, representation, and remuneration. But also we have the principles that care as a public good is the way it has been seen. So the government has a very strong role to play in this agenda. Care as a state responsibility, and also the private sector, families, communities, men and boys should be joining this, because if not, it's going to be really difficult even to think about redistribution, as you were saying, Rita, at the very beginning. Care as a human right, and also to recognize the majority contribution of women around care, and recognize the consequences that it has to push back the kind of economic participation on women in the society. So within those principles, we are also advocating for the need for accessible, affordable, and with quality care infrastructure and services. Yes, and also to recognize and promote intersectional approach to care. So we have launched this Global Alliance for Care, and I would say that some of the gaps we are seeing, because in your question you were asking also what are the gaps. It's we are seeing a gap specifically in investments on care and infrastructure and on services. I think it's not still totally understood that care is not a cost, it's an investment, you know, and if we really want healthy societies, we need to invest in care, in all the spectrum of care that goes from childcare or even previous to that, to even the community and the environmental care. We, at the Global Alliance for Care, we have this overview spectrum of care. We also are working in a spirit of co-creation, collaboration, and cooperation among the members. So we have created a very, I would say, simple governance structure with a technical secretariat that will be following all the strategies agreed by the General Assembly, but at the same time, the mode of working is co-leading. So the Global Alliance for Care, any initiative that we are launching is co-leaded with 1, 2, or 3 of our members, so that actions is embedded into the spirit of the whole membership. And so we are advancing. I will tell a little bit more about the commitments later on.
Yeah, fantastic, fantastic. And one of the things that would be really lovely to hear as we go on is when we say care infrastructure, what does that mean exactly? So let me go over to Megan. Maybe that's something you want to talk about, Megan, but would love to hear more about what you're doing at CGD.
Thanks so much, Ritu, and thanks to my fellow panelists. It's wonderful to be with you all virtually today. As Ritu mentioned in introducing me, I work at a think tank called the Center for Global Development. And CGD primarily examines the investments and the policies of international financial institutions, like the World Bank, the International Monetary Fund, and the regional development banks like the Asian Development Bank. And we also look at the policies and investments of high-income countries that have traditionally been sort of cast as donor governments. So looking at USAID and FCDO and their peer institutions. When we were founded now 20 years ago, it was really with the motivation of our founding president, Nancy Birdsall, and frankly, the frustration that she had working decades in the development sector on research and practice, that so much of what the sector has done historically is to prescribe in pretty problematic kind of top-down hierarchical ways, prescriptive guidance to low and middle income countries and policymakers within those contexts, without interrogating how the policies and investments of high income countries prescribe so much of the world order and frankly hinder progress and exacerbate inequities. And so it was that frame of mind that motivated CGD's founding. It's been with that frame of mind that we have started to launch a really robust program of research and policy analysis and convening and influencing on care work. And so over the past several years, my team has led analyses looking at the multilateral development banks, looking back 20 years to the extent to which they've invested specifically in childcare. And we hope over time to be able to broaden that focus to be consistent with, as Kelsey persuaded us all in her opening remarks, to pay attention to the broader spectrum of care work and care services. We've done the same for G7 donors, although as I'll pivot to in a second, that is where knowledge gaps in particular persist, and we're going to need to be able to generate more robust data and evidence. And then we've also sort of broadened beyond traditional overseas development assistance. So not just looking at those financing flows from the MDBs and from bilateral donor agencies to low and middle income countries, but also interrogated migration policies and pathways. Because to Emilienne, your earlier point about the intersectionality surrounding this issue, so many of the predominantly women who are performing care work in high income countries have come from low and middle income countries. And these are low income women, these are women of color, these are women who often lack the social safety nets, the language, the social networks to be able to advocate on their own behalf and be able to seek the support services to ensure quality work, compensation, training, and labor protections. And so in partnership with my migration colleagues at CGD, as well as in partnership with another think tank called ODI, we've put out a report just several months ago that I'll share with all of you in the chat that looks at how we can better support migrant care workers coming from lower income to higher income countries, specifically as it relates to care for older persons, so elder care. To pivot quickly to your question on gaps, Ritu, I mean, there are many when it comes to knowledge gaps. We are seeking to fill those through the data and evidence that we're analyzing and generating. But in particular, as I mentioned, when it comes to DAC donors, we were unable to do the kind of granular analysis project by project that the MDBs allowed us to do. We just don't have as much transparent data on the types of childcare, elder care, care for disabilities, type of investments that USAID, FCDO, and their counterparts have done historically. So that is definitely a knowledge gap to fill. And I'll just hold for a minute on the financing and provision gaps. In responding to later questions, that's where a lot of our results and findings come down. But suffice it to say for now that I fully agree with colleagues who've spoken already that these are fundamentally the gaps to fill when it comes to both public sector and private sector financing. So I'll leave it at that for now.
Wonderful, thanks. I look forward to digging into that. So last but not least, Meredith would love to hear more about what you're up to at the ADB.
Thank you, Ritu, and thanks everyone for a wonderful introduction. So from Asian Development Bank, we do have a program and work on childcare services, including a report that will be out later in this year, conducted in collaboration with the ILO on childcare services in the region, which may be of interest to some of the audience. But as Ritu highlighted, my area of focus is really on aging in care and the elder care or aged care sector. So I'll talk a little bit about what Asia Development Bank has been doing in this field. Our largest body of work and investment to date has largely been in the People's Republic of China, driven very much by strong demand from the government, and we have a substantial portfolio of projects and technical assistance related to aged care. The government of China has a very clear policy related to aged care, and what ADB is supporting is really how to translate that policy into implementation on the ground. So they have a very clear vision of a 3-tiered care system, as it's called, with the majority of older people being supported at home, a smaller minority in the community, and then residential care for those who really need it. So what ADB has been doing, we really focus on the least developed areas of in PRC and the 3rd-tier cities, etc. We're really working on how to implement those policies with a focus on investments in community care services, how to develop affordable services, ensure there's coverage, and a lot of projects are really focusing on this health and social integration, which is also a key aspect of aged care. Some of those projects are focused in care services in rural areas, which is a key aspect in People's Republic of China, especially given the internal migration with many older people residing in rural areas, and their limited family members are in urban areas. And really the focus is what we've learned from that. When we started in this field, there's a very strong focus on the residential care. And we've really been trying to promote, what are some of the good home and community services that can be developed from that. Beyond China, and this is some of the work that I've been sort of heavily involved in, we're providing technical support to a number of our other member states. We've been working in a number of countries over the last few years, provide technical assistance to analyse the current situation of care for older persons, develop regional and international sharing of practices and learnings, and then through a series on supporting a series of sort of strategic planning around aged care, which really is focused on sort of bringing together different stakeholders to identify priorities and identify what some of the key investments required going forward will be. And that could be on services, on human resource development, or quality management systems, or how to effectively support family caregivers. From that work, like Tonga approved its first national strategic plan on aged care back in, I think, 2 years ago. And last month, Mongolia actually approved their first strategic plan on aged care, which we're really pleased to be able to support. Last year in Indonesia, they launched a very comprehensive, holistic national strategy on aging signed off by the president, and long-term care is very clearly articulated in that as well. So this is some of the technical assistance that we provided. Following on from that high-level strategic work, we're now really trying to identify, what are some of the models of community-based care for older persons that really could provide affordable, sustainable, and effective care. So we're working in a number of countries to develop those pilots and really pull out the evidence base around those. Thank you.
Wonderful, thank you. And I hope we could get into some of the details of these strategies. What are the key elements of these care strategies? So I'll be coming back to you on that, Meredith. So the next thing we want to look at is to get a little bit more granular on the commitments and responses we're seeing from governments, civil society, and the private sector. And I would love, in the context of this question, to talk a little bit about what does care infrastructure really mean? Does that mean physical infrastructure? Does that mean legal infrastructure? Does that mean policies? Does that mean what kind of systems? So let's get down to a more granular level when we say make investments in care. What does that actually look like? What does that entail? So first, we're going to go to Emmeline De Leon. I know, Emmeline, that you may have to drop off soon, so I want to make sure that you are able to really dig in on this question, and then we'll go to Jessica next.
Okay, thank you so much. So saying that from the Global Alliance for Care, we have 5 action areas that it's the way we are working. So one, it's about knowledge and data information. We are creating a platform to get all information and all these surveys that are being shared here or presented could be there, so anyone could go there and share and learn what they are doing. Also, a community of practices and share of experiences, it's another area. Communications area, we are willing to launch campaigns around awareness about care, and also advocacy. And finally, an internal objective. So we have seen commitments of governments around even organizing an exchange of experiences. For example, we just launched in this month, organized by the government of Peru, the National Institute of Women, and also participating the government of Spain, around what they are doing about care systems. And so these are exchanging of national care systems, how they are advancing at this level. And I would say that you can see one of the infrastructure is needed, it is legislation. So in some cases, like in Mexico, there is two pieces of the legislation. One is in the Constitution, creating the right of care as something that it's a very strong right, you know, and while creating a specific law for a national system of care. In Peru, there is also the national system of care being developed. And in the case of Spain, we would say, but they already have this welfare system. But no, there's still a feminist perspective on these legislations. And they have created also kind of a committee that it's analyzing from intersectionality, how this evolved, because it entails also the labor rights of the care workers and the care workers, but also recognizing that maybe the housewives or the women at the home can be also transformed into certified care workers, rather taking care of the families or working outside, having these options. Also, I would say infrastructure means how do we support the creation of cooperatives of care workers and not going through the private system of giving these services through the private sector. You know, I'm not saying that it's not going to happen, but we need to promote this. So we also leverage the labor rights and the recognition and representation of the care workers. So that exchanges also came with a presentation of 30 best practices of care around the world that has been launched by the National Institute of Women. And we are also going to have another workshop at the end of this month around local systems of care, like in cities, because cities can become like a nation in some cases. Now, so we are going to analyze some of them. We also are seeing a commitment on understanding what it is needed. Do we need a specific right to care, or do we get care as a right that is transversalized in any of the education, health, economy, you know? And that's a discussion that we have been launching with the Frederick Ebert Foundation, co-leading with the Global Alliance for Care as a community of practices. So every first Tuesday of a month, we are analyzing with experts from all over the world this kind. And with the other commitment we are seeing also, it's around the private sector, that it's willing to understand better, as Jessica was saying, what happens to care? How do we deal with that? So we are launching another community of practice around private sector and care, together with some corporate sector in Mexico, international corporations, and with an organization, an NGO in Argentina that is working very closely with the corporate sector around. We are also launching as a draft guide on how to work care in the private sector. But that's one of the, I would say, one of the challenges of the Global Alliance for Care is how we can expand the private sector, inviting to be part of the Global Alliance for Care. I think that's another infrastructure that has to be built, because the private sector should be aware it's not only an investment, it's paying back to society also, you know, how to invest in healthy societies. So it's about daycare facilities, but also having specific policies within their companies or their entities to promote this. So we are seeing all these type of commitments. I want to also say that the Global Alliance for Care is not necessarily, it's not in a space where the commitment has to be follow-up and monitoring. That's a role of the UN Women and in the Gender Equality Forum, but we will get a lot of information. We are seeing a lot of traction from many governments looking for how do we can perform better. But the gap, and I would say it's how to invest on this. This is a panel about investments, and it's cost for the budget of the governments. However, UN Women and the Mexico government have been working on how to make this analysis in a way that you can look at the budget, at the general budget of a government and see, oh, we can get from this and invest on care. We can get from this and invest on care. Instead of a specific budget on care, it has to go through the different titles of the budget, let's say, that can be getting into that. So I think when we are seeing the new incentive fund for childcare launched by the World Bank, where the US government and the Canadian and others are investing money, it's about loans. I would say we need to expand that notion about loans and to really from the northern global economies to invest on the low and medium income economies to this, but invest. Because if we begin to bring only about loans, I think the low and medium income economies governments will be, oh, we already have debt. So do we have to add another layer of the debt? And that could be a kind of an obstacle or a barrier to push into the governmental thinking that carries part of the budget and they can invest on that. So kind of bringing a big push to that as an investment will be really great. And then the loans can come, and the notion that care is an investment for healthy societies will come very easily to governments. So I will end it here and say that anyone that's invited to be part of the Global Alliance for Care, and please just contact us. We are really willing to embrace everyone, and all of our panelists can be part of it, as ICRW is already there.
Thank you so much, Emmeline, and congratulations on all of this incredible work that you've done in such a short time period. Jessica, over to you. And I think it would be wonderful to talk about, yes, care is an investment that pays back in numerous ways, but it can also be literally a business opportunity, right? That can pay back profits in the United States and many other countries. Care work, whether that's elder care or childcare, is big business, right? It is an economic opportunity for companies as well as for individuals. And would love to hear you talk more about, does the private sector see it that way? And what progress are you making in attracting companies to this as where they can get a return on their investment?
That's a really great question and really great point. And you may have seen this recent report from Pivotal Ventures that values or that estimates the value of the care economy just in the US is $648 billion. So it's a huge investment opportunity. And I think we are, now increasingly talking about the opportunity, the business case of investing in care. And it's slowly trickling down. But I think kind of beyond these big figures, it's really about making it very visible and very tangible for the private sector and individual investors of what is it actually, the role that you can play and how you can tap into that investment opportunity. I mentioned a little bit earlier that the 2X Collaborative and Gender Smart are leading this care economy working group. And we're really diving into that question. So exploring the role that different types of investors with different types of capital can play in promoting more investments into care, but also greater quality. And really diving into these opportunities and more specifics and kind of showing case studies and facts and figures and opportunities to practically do it. So it's definitely a key trend that we see in the global investment space, especially when it comes to the field of gender lens investing particularly. And many investors are now exploring what type of capital is actually needed. What are the investment opportunities? What are we, also to your question earlier, what are we actually talking about? And importantly, what we're seeing increasingly is that it's not just the question of how do we channel more investment volume to the care economy, but also how can we take this transformative approach to care and value care work in terms of quality of care, pay equity for care workers, and in a broader effort to promote gender equality. And this also means that we see a great opportunity for engaging both women and men in driving innovations for care investments. For example, something that comes up a lot is that, we see, for example, entrepreneurs or businesses talking about training more care workers. But a crucial problem in our system is that, care work is so undervalued and it's so badly paid and the conditions are so terrible. And so for us, this is really a key lever, to take that transformative approach and looking at it holistically and also really focusing on quality and representation of care workers. When it comes to your question about specific investments and what does that actually look like, what are the investments and commitments, there are a range of different angles from which you can look at this. So there's, of course, the social infrastructure. And so that could be, for example, investing in care companies, such as companies in education and healthcare, elder care, childcare, with a crucial focus, again, on quality and pay equity and so on. You could also look at it from the entrepreneurial perspective, so funding entrepreneurs, startups, small and growing businesses that have innovative care-related businesses and are coming up with new innovations. Then you could also look at it at really investors investing or focusing on any type of company where you could work with the company in the private sector to improve workplace policies and practices and provide, for example, fund and provide employer-sponsored childcare or help these companies play a role in the local ecosystem to support care-related infrastructure. You can also look at physical infrastructure. So that's something that we're trying to explore more with some of the types of investors that have been investing more in traditional physical infrastructure and looking at how can you have a gender responsive project design so that you're intentionally focusing, for example, on reducing women's time poverty or redistributing unpaid care work from households to the public sector or the private sector. And that's something that has been traditionally quite gender blind, so not really taking that gender responsive lens to it. But even when you're talking about physical infrastructures like building roads or transport or energy, there are great opportunities to focus on this opportunity to redistribute unpaid care work or alleviate women's time poverty. In emerging markets, it's also particularly interesting to see new innovations, which often looks quite differently from what we've traditionally seen in developed markets. And I think this is also a great opportunity to rethink care and our approach to investing in care. For example, we see women-led investment funds that are spearheading new approaches to care economy investments with more innovative financing structures, focusing on a transformative approach and also inclusive social impact. For example, Educate Global in Kenya or Scenario Capital in South Africa. So I think looking at these models and getting inspired can also be very tangible for investors to understand it. Globally, investors are mobilizing for care. We see pure private equity and venture capital, but we also see a wide spectrum of different types of funds. So impact funds, grant capital, capacity building. And there's a particularly interesting case and opportunity to focus more on blended finance. So combining these different types of capital for greater impact. For example, where public capital can crowd in private capital, or where we can experiment with, for example, outcomes-based finance, where you incentivize the quality and the depth of impact so that basically your financial return or there's an interest rebate on demonstrated positive social impact and quality. And this is particularly well suited when you think about harder to reach target audiences, for example, or most socially excluded groups. And then all of that has led us to a very interesting question that's top of mind for many private sector players about, what's the right balance between the role of the private sector and the public sector. And we all recognize that the public sector plays a very crucial role and, has to continue to play that role. So it's all about finding the right balance. And I think it's also essential that we apply the social lens of leaving nobody behind and seeing how the public and private sector need to work together and play these synergetic roles so that you have that additionality and we can have more transformative impact.
Wonderful, great. And I just want to point to a comment in the chat about sort of the profit principle, and is that at odds with quality and equity and those kinds of things in care. So just there's a tension there, right? There's a desire to advance a private sector solution, which could happen at scale, and yet not to be driven by profit and maximum profit, which squeezes pay and quality. So let's move on to the next question. And Meredith, I'd love to start with you and sort of blend the questions together. Which is in terms of, what are we seeing in practice when it comes to financing? What demands are coming from countries? If you could kind of really break down for us, if we're thinking about financing the infrastructure for care work, again, what is in that strategy? What are the key elements of those government strategies? Where do you see this going in the future? So let's start with that question, and we're sort of moving the conversation forward in terms of what is the package? What does this package look like? Thanks.
Okay, thanks, Ritu. Well, just in terms of what is the sort of the need and demand for aged care in Asia Pacific, I think Kelsey highlighted right at the beginning, the very rapid demographic change in the region, like nearly doubling of the numbers of older persons in the next 30 years. And obviously, I think one key element to be very conscious of when talking about aged care is really the differing dynamics. Obviously, aged care has been a family responsibility, but with increased longevity and increased complexity of care and migration, etc., it is becoming more complex and it's quite uncertain, etc. So the dynamics of care is changing, which means there is sort of a necessity for more skilled care. Given that, though, in terms of policy, actually a number of countries in the region actually legislate that it is the family's responsibility to provide care. So that really is often the common framework that you are working in. So yes, a number of countries say primarily it's the family responsibility. Having said that, when we did a review of some of the long-term care systems across the region, we didn't see much practical support to support families in that role, which is a key gap. In terms of area, what is there currently? So again, most countries at the moment would have a very basic social safety net for care, i.e. for persons without any family support. There'll be a public residential home. The private sector is coming in very rapidly to provide services to those who can pay. Often many people in the region would have, the upper middle classes will have domestic workers, often migrant workers providing that aged care. But the real gap is, the care services for the low and middle income populations, i.e. the majority of the population, their quality, how to get affordable and quality services. So that's really where the investment needs to be, and is why Asian Development Bank is really sort of promoting and supporting governments to implement their own policies which focus on aging in place, to support older peoples to age in their homes and in their communities. So what we're seeing in the region is sort of not a huge amount of investment, but increasing investment in the role of strengthening community organizations, social organizations, to be able to realize that. Thailand has initiated a very interesting community-based program. It's funded under the Universal Health Coverage Scheme, but that's employing community caregivers to provide care for older persons in their home, and it's overseen by their health system. So it's a really good example of health and social care integration. But a key element of programs such as this is they are a complement to family care. They're never a replacement. So it's to provide a little bit more support to families to help them fulfill their duties in caregiving. So caregiving is still largely a family, and the care is provided by the female family members. But in terms of investment, like, it's interesting to listen to this discussion and reflect on our experience in working in that strategic planning process was actually the importance of getting the right stakeholders in the room. In terms of aged care, you know, even at a ministry level, it's often very divided or very, very unclear who is responsible for it. Is it social welfare? Is it health? How to get ministries of finance in the room if you're talking about education and development, to get education and labour in the room. So really bringing these stakeholders together is absolutely key to be able to identify the investments, and again bringing in those service providers and local authorities who play an absolutely key role in the delivery of many of these care services. So bringing that together to come to a common understanding and identify priorities. In terms of the areas of investment that were really highlighted in these plans, so obviously service development, which is really about a focus on community-based care services, whether it be community centres or supporting home care services, etc. On human resource development, as already highlighted, aged care is becoming there are quite a lot of skill gaps. There's a lot of job opportunities in this field if we can address some of those issues that Jessica highlighted earlier, and in quality management. Much of the care services in the region, especially private care providers, they might not be integrated or really overseen. There's very little stewardship at the moment, and that really came to the fore in COVID, when governments realised that they didn't have that stewardship over many of the care providers.
Yeah, and I think you put your finger on sort of the essence of the issue, which is that the government view that female family members are primarily responsible for care. And that assumption, that undervaluing, but that assumption that female family members will just provide that care for free at no cost, as a huge subsidy to the economy. So Manda, I want to come over to you and to have you talk a little bit about the Care Economy Index in Africa and what you're finding, what you're hoping to do with that index. Thanks.
Thanks, Ritu. Once more, just kindly confirm that you can hear me.
Yes, we can hear you clearly.
Okay, great. I think in relation to policy and practice, which is where the Care Index really comes in, I would like to begin by stating that the last couple of years have seen, I think, a lot of efforts going to building a case for why care is so cardinal to our economies and societies, even within the African context. But we still see very little being done in terms of recognizing care work and actually rewarding it and investing in care work. And we have been able to link, the failure to recognize care work very closely with some of the very neoliberal policies that we have within our countries, which, would be based on a concept and an assumption that we humans exist in a very individual setup, that we do not need care as much as we do to be productive. But this isn't the case in the African context. This does not work for the African context because we're a very socialized society, and we're very largely dependent on a productive population for economic development and, going into the future. So while care remains a very, a very global area of discourse, it's also very definitively diverse in very different contexts. And this is why we thought it's very necessary to develop an Africa Care Economy Index because this will now zero in on the contextual issues relating to care within the African context. And it highlights some of the very defining gaps in the care economy by measuring and mapping the current social recognition and state support within African countries. This has been done across 10 metrics within all the 54 states in Africa. So this index is set to provide an analytical framework on care for the African context. And we hope to use this as a regional tool for our strategic messaging and for capacity building, for advocacy engagement across the region. And we hope that at the end of this, we could be able to inform and influence national level policies and strategies, which hopefully will then translate into investments into the care economy in the African context. So this care economy index was launched in May of this year, and it did have some very interesting statistics, some very interesting findings, which I will not delve into entirely because of time, but then I could point to a few. And I think the first one that I could really mention is that it highlighted the lack of socialized childcare related to laws and policies across the African countries, with the exception of one country. Only one country in Africa really has laws and policies that speak to childcare. And in Algeria, we see 83% of cost of nursery care being subsidized by the state or by the Ministry of Labor and Social Works within that country. But then it also highlights that that in Africa, I think care work is above the global average for women in the African context. And this is where they're caring for the sick and people living with disabilities. So no African country has policies that recognize or invest in care for people living with disabilities, which I think is a bit of a stretch considering just how much disease and how much of our population is actually living with disabilities within the context of Africa. Another thing that was really interesting is maternity leave. Fortunately, is available in 53 of African countries, except in one, which is Sierra Leone. Yet to really define why that is, but then I think it's only logical that someone does need maternity leave with the benefits, of course. However, looking further into that, we do have, I think, a significant amount of time, could be more within the African context for maternity leaves. It's about 8 to 17 weeks. But then there are some limited benefits within that people do get within this maternity leave period. And I think this continues to be a problem because we state that only about 15% of women within the African context actually get those benefits during their maternity leave. I think this is still an issue that we would need to relate with going forward, but there's a lot more to be done. We realize that. As Femnet, obviously, we want to be able to continue this discussion within the African context because of our social cultural norms. It's not something that was really recognized, and over 70% of care is provided by family members, most of them being women and girls, because that's how we've been socialized to provide care. So we want to continue having these conversations. We also want to collectively define what care work is within our countries and to begin to recognize it. And to reward it, obviously, at the end of those discussions. The index is our baseline. So we hope to have conversations based on this with our policymakers, our governments, and this is across all the 50 states that Femnet is present in and is working with various women's rights organizations to start to have these conversations to continue building a case for investment in care work. I think that's really what we're seeing within the African context, and the Africa Care Index does provide, I think, a very good contextual analysis based on which we can then start to advocate for more investments in Africa's care economy.
Fantastic. Thank you so much. I think that data gathering that the index is doing is phenomenally helpful. So Megan, you brought up the really important issue of migration and long-term care in particular, and would love for you to talk more about that. How does that fit into the concept of investing in care or financing structures or government policies? So would love to zero in on that issue with you.
Yeah, thanks, Ritu. So happy to start with migration, and then if it's okay, kind of zoom out a bit on broader financing work that we've done. As others have underscored already, and I think, really appreciated the note that Talia mentioned in the chat about this tension between perhaps privately provided care and the need to ensure high quality care that isn't just sort of driven by profits for these huge conglomerates. I think within the migration context, the analyses that we've done, again, focused on migrant women coming from low and middle income countries into high income countries, underscores this tension, because fiscal austerity, is not just something that's plagued the developing world, low and middle income context, but also high income countries are subject to these budget cuts, depending on those in political power, those in particular administrations with certain ideologies and views on fiscal policy, that have meant that over time in the US, in the UK, across Europe, across East Asia, we have unfortunately seen either entirely too low of a share of investment going to long-term care, but also child care and the broader care continuum. Or we've seen in certain sort of generations under certain administrations, these investments from the public sector increase, but then be radically reduced, as administrations have changed. And this obviously, as Jessica and others have noted, have implications for the quality of care being provided, especially in the absence of strong regulatory frameworks and an ecosystem of the public sector being able to really set limits on what the private sector can sort of run rampant and do. But I think now, to sort of complement that critique, one of the things that we really sought to do in this report focused on migration and the care sector is to nuance what we mean by private sector investment and provision. And I think Jessica already did a fantastic job of sort of showing us the plethora of ways that the private sector can contribute, including in positive directions. One of the models that others have touched on and that we were particularly optimistic about in doing our analyses is that of worker-owned cooperatives. So the private sector can mean huge conglomerates of thousands and thousands of people, sort of unsupervised by the state, by the government. But it could also mean these cooperatives that we found, for example, started by South African women who had migrated to Ireland, who in these small groups entirely own their business. It is a for-profit business, but they're keeping the ratio of caregivers to care recipients quite low. They're working in very localized ways. So they're finding their clients in small localized communities. And they're proven now to deliver a high quality of care at a lower cost while still being able to pay a fair wage and in a cooperative context, even increase the ownership shares of those workers, feeding into that private sector model. So I think remaining nuanced in our understanding of what the private sector consists of and the different models and forms it can take is really critical. Just to broaden a bit now to the sort of broader financing questions, I had mentioned earlier the analyses that we had done on multilateral development banks, historical investments in childcare, and the same for the G7 for some of those sort of top DAC donors. And this is where I think, now pivoting back to what governments are responsible for and what they are not delivering on quite yet from a kind of donor to recipient country perspective, we see just huge, huge gaps to fill. So the data that we crunched started in 2000, went through 2021, and found just about $2 billion across 8 institutions across 20 years going to dedicated childcare projects. And some people might say, well, $2 billion kind of sounds like a lot of money, right? That's not money I'm ever going to have on my own. That sounds quite ambitious. But to put it in context, that same amount of money is actually exceeded by, just in 2021 and just at the World Bank, the amount that was given to oil and gas projects. So more than $2 billion in 1 year to oil and gas projects. And I think that one of the things we want to do is start to really put these figures in the context of broader fiscal space analyses and conversations to really push back against traditional rhetoric brought by donors, brought by country governments that says, well, COVID has hit really hard and we just don't have the fiscal space. We just can't make room in our budgets to prioritize these issues. I think as other panelists have spoken to, it's time to really bring that return on investment evidence to bear to show what missed opportunities are being sacrificed in terms of human capital development, women's labor force participation, productivity, even GDP growth, right, and broader economic welfare. Sorry for the beeping outside. Hopefully that's not too disruptive. To sort of start to make the case that, look, this is actually more of a matter of political will. If we were to deprioritize certain line items in government budgets and reallocate those resources towards care services and care infrastructure, that would be a better buy, right? Over time, that would be better for the human welfare and the economic development outcomes within a given country context. So working very closely with the ILO, the World Bank Child Care Incentive Fund that Emilian mentioned, this is the kind of evidence we're going to be synthesizing and harnessing so that folks on the advocacy side, sitting within the MDBs, can make that case in a compelling sort of country-specific way. And I'll end there because I'm just not sure how loud this is.
That's all right. Thanks so much, Megan. That's fantastic. So we have about 7 minutes left. We've had a lot of questions in the chat. I'd love to have everybody just give some closing remarks. And if there's, one takeaway that you'd like everybody to leave this call with, what would that be? What's the main message? And Jessica, let's start with you.
Thank you. So this has been an incredibly rich discussion. And I think for me, there are at least 10 outcomes. But if I have to choose the top 3, I would say, first of all, make sure that care workers are front and center of whatever solutions we are designing. So make sure that they are at the decision-making table and that we hear their voices. Second, I would say, looking at this globally, don't blindly copy paste the traditional model that we've seen in the US and in Europe. We see very innovative and different approaches to care across countries globally, and local context is incredibly valuable and also offers us an opportunity to rethink the whole care system. And then third, I would like us to move beyond this public-private sector dichotomy and really see what's the role that public and private sector can play. And totally agree with what has been said also in the chat. Let's make sure that we always focus on quality and see what is the best combination of capital and different players to ensure high quality.
Wonderful, beautifully, succinctly stated. Over to you, Meredith.
Hi, thank you. I think just to echo a bit of Jessica's point, like reflecting on the strategic planning process on aged care that was conducted in a number of countries, one of the key elements was really to support governments to think through their role in planning, incentivizing service providers, their role in oversight and regulation, and really understanding who is out there in terms of the private sector, the public, the role of CSOs, etc., in providing that. So really continuing that discussion and making sure that there's a wide range of stakeholders in that discussion. But there's also a need for more evidence, especially around need and demand for care. Sometimes, especially this aged care, is quite hidden. Mm-hmm. And I don't think the investment case is reaching a lot of these stakeholders. And I agree with what Megan said, that we really need to make it clearer and continue to build the evidence base on that. Just my very last comment is I really appreciate that aged care has been included in this discussion. It's often overlooked in the care economy debate. So we really appreciate that, and to the organisers. Thank you.
Thanks, Meredith. Well, it's where we're all headed, so it's important to bring it in. Megan.
I would say 2 quick things, mostly echoing my fellow speakers. Ritu, when you asked us earlier about defining care infrastructure, I know I didn't weigh in quite yet on that particular question, but I think in addition to pushing past an understanding of physical infrastructure, to now be understanding human capital and these essential workers as critical infrastructure within the care context, really underscoring the need for data to be a key ingredient as part of that infrastructure. And I've been particularly compelled by the National Statistical Office in Buenos Aires city in particular, that has now championed and created this data portal on care so that they are taking charge as a local government, understanding the supply side and the demand side data and the gaps that need to be filled within those two. And hoping over time with Marisa Miodowski, who has really championed that effort, to use that as a model that other governments, subnational and otherwise, could emulate, so that we have a better understanding of the baseline and the needs to address going forward. So that it's not just incumbent upon those of us as think tank researchers or FemNet advocates to be doing that data work. It really does need to be led by policymakers themselves. And then the second thing that I know has been touched on in conversation, but just to underscore, is the need to break out of our silos as we continue to have these conversations and convening those relevant stakeholders that Meredith referenced. In the childcare space specifically, we've been pretty frustrated by how few early childhood development evaluations, for example, look at caregivers' outcomes, look at women's labor force participation or mental health or broader well-being. And we have such potential to be forming a strong coalition of people who think about older persons, who think about children, who think about domestic workers, who think about women's economic empowerment. We are so much stronger together, but we need to start to come together and speak in similar language in order to be making that compelling case across sectors and find different entry points into governments and other decision-making contexts.
Well, thank you for that. I want to thank everyone for a really wonderful, rich discussion. Appreciate all the comments in the chat. I just want to highlight one of the comments in the chat, and we've talked a lot about caregivers. We've talked a lot about sort of government infrastructure. And one of the things that is important to consider are the recipients of care, right? Their agency, their participation in care. So just to throw that out there, I thought that that was a really wonderful, insightful comment in the chat. So thanks to all of you for really engaging substantively in the chat conversation. Here's our contact information. We'd love to have you as part of the coalition. We'd love to have you get involved with us. Ping us on social. There's our website, our corrected Twitter handle, which is @WeProsper Global. So thanks again. Thanks so much to our panelists for just the incredible work you're doing and the progress that you're making on the care economy. And on behalf of CARE International, thanks so much to WeProsper and to Kelsey for helping us organize this event. So have a good day or good afternoon or good evening. Thanks, everyone.